Hello, and welcome to Health Agent, your daily look at the breakthroughs, investments, and policies shaping healthcare around the world. I'm Mira, and today we've got a packed lineup from billion-dollar pharma bets and new AI rules to vaccines in Africa, cholera emergencies, and why the UK is at risk of losing its edge. Let's get started. 1. Global health rules just changed. First up, a major milestone in global health security. The World Health Organization's updated international health regulations have officially come into force. These rules are meant to make the world faster and fairer at spotting and responding to health emergencies, something the pandemic taught us we desperately need. But here's the twist. The United States rejected these amendments, arguing that they undermine national sovereignty. So while most of the world is now aligned on new standards, the biggest player is not fully on board. That could complicate coordination when the next big outbreak hits. The takeaway? The world has stronger guardrails, but not everyone is driving in the same lane. 2. Outbreak Watch, Ebola and Cholera. Let's turn to outbreaks. In the Democratic Republic of Congo, health workers are rolling out the Ervebo Ebola vaccine in Kasai province after cases were confirmed earlier this month. The strategy is to ring vaccinate, protecting frontline staff, contacts, and contacts of contacts. Meanwhile, cholera is making a dangerous comeback. The WHO reports 31 countries facing outbreaks this year, and deaths are rising. What's fueling it? Conflict, poor sanitation, and climate shocks that disrupt water systems. Bottom line, vaccines and rehydration kits help, but without investment in clean water and infrastructure, the cycle repeats. 3. Pharma money moves. US up, UK paused. On the investment front, the money is flowing, but not evenly. Eli Lilly just announced a $5 billion plan in Virginia to produce cutting-edge cancer and autoimmune drugs. That's 650 permanent jobs, plus thousands during construction. And this is just one of 4 plants Lilly plans to build in the US. At the same time, GSK says it will spend $30 billion over 5 years in the US on research, manufacturing, and AI-driven drug discovery. But here's the contrast. In the UK, companies like Sanofi, AstraZeneca, and Merck are pausing or canceling billions of pounds in projects. Why? They argue that UK drug pricing rules and regulatory friction make investment unattractive. So America is doubling down on domestic manufacturing, while the UK risks losing ground in pharma innovation. For policymakers, that's a red flag. 4. AI in healthcare devices. New FDA rules. Next, let's talk about artificial intelligence in healthcare devices. The US Food and Drug Administration just finalized guidance on what's called predetermined change control plans. That means AI devices can be updated safely, without going through a full approval every time. Why does this matter? Because AI tools improve with data, and hospitals don't want to wait years for better performance. But there's a catch. These plans must clearly spell out risks, validation, and monitoring. Recent data also show that most AI device recalls happen within the first year of approval, usually because of errors in measurement or diagnostics. That's a reminder. Innovation is exciting, but oversight saves lives. 5. Europe's data and AI framework. Over in Europe, regulators are laying their own groundwork. The European health data space has been adopted, aiming to standardize and unlock health data across borders while protecting patient rights. Paired with the EU AI Act, this means any AI used in diagnosis or treatment will be classified as high risk, requiring rigorous testing and ongoing surveillance. For startups, that's a challenge. But for patients, it's reassurance that not every app calling itself AI powered can slip through unchecked. 6. UK Policy Corner, NHS League Tables. Back home in the UK, the government has just launched NHS League Tables. These public dashboards rank hospital trust by performance, with the idea of rewarding top performers and helping those that struggle. Supporters say this transparency will drive standards up. Critics argue it risks oversimplifying complex care and could punish hospitals dealing with tougher populations. And all of this is happening while NHS waiting lists remain at record highs. So the question is, will league tables motivate change or just add pressure? 7. Looking ahead, UN high level meeting. Finally, mark your calendar. On 25th of September, the United Nations will hold a high level meeting on non communicable diseases and mental health. Expect big conversations about prevention, funding, and how to curb deaths from conditions like heart disease, cancer, and depression. Why it matters. These are the diseases that cause three-quarters of deaths worldwide, but often get overshadowed by outbreaks. And that's your Health Agent update for today. From new global rules and outbreak responses to pharma money flows, AI guardrails, and NHS reforms, it's clear healthcare is being reshaped in real time. If you enjoyed this briefing, hit like, subscribe, and join me tomorrow evening for the latest in health and technology. I'm Mira, and this is Health Agent.